put out a statement just a short time ago saying that she was told it was not related to her job performance. Would you agree with that assessment?
I would say that every commissioner works at the pleasure of the governor, and the governor and this administration has decided to go in a different direction. We wish her all the best.
The Day of New London.
Hello, Governor. For you, I wonder if you could talk a bit about the distribution of the PPE. Now that we've got all this, how do you ensure that it goes to where it needs to be, the most urgently?
Yeah, well, right now, our first priority is to make sure that all of our hospitals, first responders, nursing homes not only have the PPE they need for tomorrow, but have a little capacity there. I want them to have the confidence that they can use that appropriately. I think from there, we're going to expand to other first-line responders, frontline, food service workers and the such. We do provide backup support for nursing homes, small business and the such. They take the lead in terms of securing their own PPE, but as needed, we're there to back them up as well.
Thank you.
Boceto Media.
Good afternoon, Governor. Yesterday, you reflected on for underestimating the impact of the deadly virus for following that advice of U.S. Surgeon Jerome Adams, comparing that COVID-19 with the flu, and some Connecticut residents are criticizing your judgment in the beginning of the pandemic. What would you like to say to them?
What was that about the flu and the COVID pandemic?
I can repeat my question. I said that this week you reflected for underestimating the impact of the deadly virus for following the advice of U.S. Surgeon Jerome Adams.
Oh, yes.
Comparing the COVID-19 with the flu, and Connecticut residents are criticizing your judgment from the beginning of the pandemic. What would you say to them?
Yes, the question involved the fact that the Surgeon General did come up to Connecticut probably 2.5 months ago, and he said for most people, COVID could be like a bad flu season. And that was not great advice. And I'm really happy that, Connecticut was one of the states that really took the lead in terms of social distancing, closing things down. I hope nobody got the impression out there that everybody thought it was going to be a really bad flu season, because a really bad flu season, we lose maybe 125 people. We've lost over 3,000 of our Connecticut souls. So that was not the right message.
My second question, Governor, would be Dr. Fauci said today that reopening schools and universities in fall could be serious, especially since it's predicting vaccination in 2 years. What actions is the state going to take since you guys already presented plans to the state?
I'm afraid you broke up a little bit, but I think the question again was on Dr. Fauci. We have talked to Dr. Fauci. We sort of are supportive of the guidelines that came out of the task force. I thought they were constructive. We refined the guidelines here at our own state reopening committee, led by the science, led by the scientists, and that's why we're following those metrics very carefully. We're not being premature on this.
The Hartford Courant.
Hey, Governor. I have a question about the contact tracing component of the reopening criteria. Can you explain to me the concrete goals that you would like to see the state get to on contact tracing by May 20th? I'm thinking maybe the number of volunteers that you'd like to have at that point, or the number of participating health departments, things like that.
Yeah, let me start with that and then hand it over to Josh. Look, hand in hand with all the testing that you're hearing coming from Jackson and Yale and Hartford and others is the fact that we have to be able to follow up with people who are found to be infected. We have to find out who they've been in contact with. And that's one of the reasons we've said, look, keep your groups to 5 or less, so that there's many fewer contacts that you've had over the course of that 3-4 days that maybe when you were infected we didn't know it as yet. They, in turn, were reaching out to all of the health departments across the state. We've already got the Microsoft platform up and operating. Josh can tell you how many of those calls are already beginning to be made. We're starting with our local public health departments. We're starting with our Department of Public Health as we bring on volunteers. So as we go along with more testing, contact tracing is way we can contain any potential flare-ups out there.
Yeah, I think perfectly said. The goal and our criteria for contact tracing was to have the system up and operational, and so this week that system is up and operational, and we're onboarding the first public health departments this week, and we'll be off to the races. The first priority, as the governor said, is getting the local health departments all stood up in collaboration with our hospital systems, as well as Marna mentioned earlier. And then from there, we turn our attention to the volunteers and the additional staff that can become the surge capacity for our local health departments. If there is a flare-up in a certain area, we can deploy more resources. That's really intended to be live for the summer in case we, as we start our gradual reopening, if we see flare-ups, we have resources we can rapidly deploy.
So can you give me some numbers with that? So as far as volunteers and staffing, how many do you think you need by May 20th, and how many do you have right now?
Right. So for May 20th, as I mentioned, the focus is on our local health departments. So between them and our State Department of Health, we estimate we'll have 300 people contact tracing on the platform. And then, as we mentioned before, our goal as the next phase is to get to 400 to 500 volunteers staffed up as well to complement those teams.
And to clarify, how many do you have right now?
So those 300 local health department officials and our State Department of Public Health are on board right now. Those are full-time employees that work at those organizations who will be trained on this new platform.
Thank you.
You're welcome.
Connecticut Public Media.
Ali Warshawski for WNPR. This question is for Marna. You mentioned the decline of hospitalizations and beds used for COVID patients. Are they, throughout the Yale New Haven Health Network, manageable, or is there a number you'd like to see that would make it more manageable for staff, as we reopen the state?
They've been manageable at all levels because our role is to be there and to be able to care for the patients who come to us in need. Where would we like to be? We'd like to be at zero. One of the things that we are doing as part of our work with the governor's teams as we look at reopening is to try and project with the best science that's out there from various models what a sustained level of COVID inpatient demand is likely to be. And we believe it's going to be less than where we are right now. It won't be zero. And we will make sure that those patients are cared for well, but that they are cohorted and the staff who care for them are also dedicated to them so that we do the best job that we can for those patients as well as for others who seek care.
Thank you. And my last question is for the governor. We had a listener write in. They were looking for an update on applications for pandemic emergency unemployment compensation. I'm assuming that's this extra $600 a week. Is everyone who applied for unemployment getting that, or still some people still waiting for that additional fund?
I believe all those, that's the true up from the federal government, that extra $600 that took the feds a little extra long to get the guidance out on that. They've done that over the last couple of weeks, and it's my understanding the Department of Labor has got all those deposits made, or at least in process, about to be made.
And it sounded like maybe there was also an interest in the PUA, which is for the self-employed, the gig workers that started going out last week. Those processes are flowing and the payments are going out. We are aware some people are running into some glitches if they enter their Social Security number wrong, and our Department of Labor team is constantly working to continue to enhance the system and answer those questions and make sure everyone's getting the support that they're entitled to during this very difficult time.
Hearst, Connecticut Media.
Hi, Governor.
Hey, Ken.
Can I ask you a little bit more about the value of the PPE that we saw at the warehouse today, and what was the role of the Chinese construction bank?
I'll start it off, and then maybe, Josh, you can do this. Let me tell you how complicated it is negotiating something like this. And it really took a while, and all the different relationships that are necessary there. The Chinese Construction Bank is they made a significant donation as part of a goodwill gesture. I think it was probably $2 million plus, so it was significant. But for us to get to the front of the line with everybody trying to source PPE coming out of China, where let's say most of the PPE comes from, took a variety of relationships. That was one of the relationships, the Consul General, Ambassador, others that were very helpful as we tried to navigate through this.
Josh, yeah?
No, I think the governor summed it up well. I mean, when the market broke down, in March, I think it was, right, and supply and demand went completely upside down, it really became, as the governor said, a scramble, right? And so we're fortunate that the governor has, incredible relationships in the business community with people with extensive relationships in China that could be called on to help broker some of these deals like the one that was announced today.
And what's the number we're using on the value of the warehouse full, the 6.7 million pieces?
It's over $10 million in value.
10 million. And can I ask a follow-up question on the nursing home testing? Is there a schedule that all the staff are going to be tested by? Is there a calendar? Are you just seeing how many you can do in X number of days?
Yeah, it's being prioritized by our Department of Public Health team that looks after the nursing homes and where they see the greatest need and where they want to prioritize the resources that are being deployed. So that will continue to unfold in the coming weeks.
Is that going to unfold into the assisted living also?
Yes, we're looking forward to that as well.
Okay, and I think, are they going to continue once they go through once of all the nursing homes? Are they going to keep going around again, keep testing people?
Yes, so one of the reasons these announcements that we made today with Yale New Haven and Jackson Labs, and there's more in the works to really scale up our testing capacity, is because for these at-risk populations, we want to make this repetitive. We want to continuously be able to test on a weekly basis for these most at-risk populations, particularly in congregate settings. So that's why we're so thrilled to have the partnership with Yale New Haven, with Jackson Labs, and we'll be announcing more in the coming days and weeks.
Thanks, Josh. Thanks, Governor.
WTIC 1080 News.
Hi. Just today, Governor Baker in Massachusetts put in for a $1 billion supplemental. Rhode Island, Governor Raimondo is talking about furloughs for state workers. It just reminded me to ask, how are things shaping up financially for the state at the end of this fiscal year into next?
It's not that pretty. We're probably looking at a $1 billion deficit in this fiscal year that ends June 30. As you can imagine, we went from being in pretty good shape to a deficit, and that all happened in about 90 days. That said, thank goodness we've got a $2.5 billion rainy day fund that allows us to power through, at least for this calendar year. We're looking at next year. That's going to be a deficit probably of $2 to $3 billion. It really depends how soon the consumer gets their confidence back and what we do with this COVID, how we get it under control. If people can slowly start getting back to work, we see the sales tax coming back, income tax coming back, we'll be able to weather this without a lot of severe cuts. And I think that's what our goal is.
And Marna, it was a few months ago that we heard about the possibility of a relapse this fall, and that's still being talked about. Do you think the hospital system can withstand that potential?
We will withstand whatever demand comes our way, and we are prepared and looking at the same models, and will be prepared if there is a spike late in the summer, in the fall, whenever it comes. I think we're all hoping at some point for a vaccine that we can administer like we do the flu vaccine so that we will be able to have more predictable demand, but we are all prepared to handle what we need to.
Thank you.
The Waterbury Republican American.
Thank you. What about test turnaround times? There were, an additional, 568 cases reported a day. How many of those were reported in the last 24 hours, and how many were reported in the last week or so?
So I don't have that breakdown at hand, but what I can tell you is that back on the partnerships we're announced today with Yale New Haven and Jackson Labs, it's worth noting that they're both Connecticut-based operations, and one of the things that we prioritized in the RFP that we put out a couple weeks ago that's led to these relationships is the importance of the speed of the turnaround time on those tests. We know how important it is to get those results back in 24 hours, get it into the contact tracing platform to be able to head off any further spread. And so that's why we're so fortunate in the state of Connecticut to have such great partners here, because when we can deliver the tests locally, we get them turned around quickly, and that's what both of these organizations have committed to do.
Or do you want to speak to that for a second? The turnaround on the tests?
Happy to, Governor. So what Josh said is exactly correct. Upon receipt of the samples at Jackson Lab, we will absolutely be turning those test results back around within 24 hours. The ability to turn around those tests, as Josh described, is immensely important, particularly for those people in our population who are the most vulnerable. And what we are doing to ensure that is we are also scaling up our operations. As we speak, we are implementing automation systems. We are bringing additional people on board, and we are very confident on our ability to scale up to get to 20,000 tests in July. Per day.
In terms of the RFPs, how many were received, and how many have produced some sort of, contract with the state?
I think we've received over 20 at this point, and these are the first two who've gotten across the finish line, but as I mentioned, there will be more.
And in terms of the self-certification, when is the Department of Economic and Community Development going to have that online system set up so businesses that want to open on May 20th can submit their plans and self-certification information?
Yeah, I think that's going to be up certainly before the end of the week, if not a little bit sooner. The team's working very hard on getting that up now.
Okay, thank you very much.
CT News Junkie.
Governor, I was curious. Dr. Deborah Birx cautioned governors from including hair salons and barbershops in their first round of reopenings. So why is Connecticut moving forward with this in the first phase?
Well, in this phase, obviously, we're close to 20 days in terms of declining metrics, so we're pretty long in this phase, I would say. It's on a totally voluntary basis if people want to open or not. We found a number of people that wish they could go back by appointment only with the strictest of protocols, and making sure that anybody who does not feel comfortable going back, as an employee, for example, doesn't have to do that, could be furloughed or continue to collect unemployment. We've got the safety of the employees paramount in our mind.
And my other question was, has the Reopen Committee hired a consultant?
No, but we have. The state of Connecticut has, and that's advising the governor, our senior staff, our commissioners, and is working with the Reopen Committee as well.
Okay, and their name is?
It's Boston Consulting Group.
Okay, thanks.
Yep.
The Connecticut Mirror.
Good afternoon. So if I hear you correctly, on May 20th, when the first reopenings occur, Connecticut is going to have a tracing workforce of 300. Why should Connecticut be confident about your ability to track any further outbreaks, given that the National Association of Health Directors recommends that a state with the population that Connecticut has should have a workforce of closer to 1,000 contact tracers.
Yeah, I mean, I think the thought, Paz, is that you want to have the contact tracing fully implemented once you've come down the bottom of the slope and where you can cover all the cases, right? And as the governor said, we're coming well down that slope now, and it's really about having that workforce in place to then be able to cover every single positive case that's identified in their contacts and prevent those future spikes. So, as we continue to come down the curve, we know there's always a 2 to 4 week lag time that we're going to wait before we go to any future phases. That's because of the transmission lag time that occurs. So we'll be well positioned with the larger group when we need it.
And what does well positioned mean? You're going to have how many of those volunteers in place by what time?
Right. So our goal is to be fully staffed by the end of June.
To have all those volunteers in place by the end of June?
Correct.
Okay. And I think, look, I think we all appreciate that you all are putting together a system of testing, a system of tracing as you move forward to May 20th. But on the question of testing, it's still a little squishy here. Can you give us your best estimate of the schedule? At what point can you tell nursing home families that their loved ones will be tested, all of them, and their staffs at those places, and then the same is true of assisted living? What is the rough schedule there?
Sure. Well, I think we've announced that our goal is to have all nursing homes tested by the end of this month, and the team is making great progress on that. Look, as we bring on more capacity, we're able to test more and more populations. We're focused on our correctional facilities. We're focused on first responders. So the circle of people we can test and test more frequently continues to grow as we ramp up. And that will continue straight through the summer.
So assisted living people are going to have to, you're talking June at the earliest, it sounds like.
Yes.
Okay. And then the last question, how is that testing being done? Do you have DPH staff or laboratory staff going to these homes, collecting samples, and then transporting them?
So it's a mix. We typically in the nursing homes rely on the nurses and the medical staff there to do the sampling. Our National Guard teams are out delivering the swabs, making sure they have the materials, and often collecting them and transporting them back to the labs. In some cases, they're actually helping with the sample collection. So it really depends on the capacity of the home itself and how we can best serve them.
All right. And last question. Again, I understand why there's an ad hoc nature to what's going on. But at what point are you going to be able to give a comprehensive view of a system that will be in place for the summer and going forward on schedules for testing, what the people of Connecticut should be able to expect from their government on testing nursing homes, testing, delivery of PPEs, all of it? Because it just has this ad hoc feel to it. And I understand, there's a reason why.
I'll start. I mean, we're doubling our testing capacity almost on a weekly basis. You've heard from Josh what we're doing, Paz, in terms of ramping up on a volunteer basis right now, all the track and trace we can. As Josh said, it's closely tied to what we're doing on the testing front, closely tied to being on the downside of the curve so we can make a meaningful distance in terms of track and trace. I think it's going to be a program that's with us for some time. Maybe the COVID pandemic slows a little bit. As Marta said, there may be a flare-up again in the fall. We're going to be able to get ahead of that. And what track and trace allows us to do is to contain it in a serious way.
Yeah, and I just add, Paz, I think a lot of the questions and discussion in these are focused on the first phase of this reopening on May 20th. There's a tremendous amount of work that's going on as well around, what does a phase 2 look like? What does a phase 3 look like? What are all the supports we want to have in place for those around testing and contact tracing? And our thought is that we would get into that in more detail in next week once we get to past May 20th.
Well, I'll tune in next week. Thanks.
I'm sure you will.
The Associated Press.
Governor, as this testing ramps up, can you talk about your own personal decision? Have you been tested? What goes into your decision as to whether and how often you should be tested? And then can you talk about other public officials, lawmakers opening the Capitol, people who can't obviously stay at home? What is your recommendation for testing for public officials?
I held off because I thought we were very limited in terms of our testing capacity. This is going back a few weeks. We said people who are showing symptoms should only do it. But that said, testing has opened up. It's now more available. In many cases, we're encouraging people to please go and get tested. So I led by example today. No results yet.
Which test did you get, and what went into your decision?
What went into the decision is I am out there encouraging people to get tested right now. I don't want to see this hesitancy. I don't want to hear people say, not for me, I'm worried about the possibility of a quarantine. I don't want to hear what's going on. You know, as Marna and Oro said, we're taking the testing to you. We're taking the testing to the communities. It's a responsibility you have, not so much just to yourself, it's a responsibility you have to your community and your family. And, you know, I wanted to lead by example. It's a very different place we were on testing just a month or two ago.
And then in terms of other public officials, what is your recommendation? Lawmakers coming back to the Capitol, getting tested, that kind of thing.
Well, I'm very reluctant to give recommendations to our legislators, but I think they're all making the individual decision themselves. When they come back is up to the leadership. Paul Mounds has been in almost daily contact with them. I think appropriately they don't think May is the month to do that. It's still too early. I think that may be our last question. I just want to follow up on what Ken Dixon said in terms of, you know, friends. I was just thinking, you know, Connecticut has some really good friends, and it allows us to punch above our weight class as a you know, relatively small state. With some friends, we got to the front of the line down there when it came to the mad rush for PPE. Remember what a situation that was a month or so ago. And we now have a 60-day supply. We actually have our own stockpile. No more waiting for Washington, D.C. Connecticut has a stockpile, and we're going to build on that going forward. You know, as you maybe know, we've had the head of Quest Diagnostics. We had the head of Thermo Fisher. We have those folks that are so key to getting the ingredients we need to do the testing, which is just the foundation of getting our state back going again, reopening a serious way. Larry Merlot from CVS made Connecticut one of the very first places where we did the drive-through testing. Connecticut has some good friends. And we also have one of the great healthcare systems in the country right here. So we look to ourselves when it comes to how we get through this. We have some amazing innovators. You've heard about some of the experiments going on. We got Jackson Labs. Oro, I can't thank you enough for what you're doing and the leadership Jackson is taking, helping us ramp up, helping us think about you know, diagnostics and therapies that may get us through this. And Marna, working with the hospitals, working with you taking the lead on this. We got through April as well as we could have hoped for, and we're ready for what comes next. Thanks, everybody.